Hi, I'm Dr. Jerry Hesch, a physical therapist who works at Hesch Institute in Aurora, Colorado. That's spelled H-E-S like Sam, C-H. And this is a presentation on a self-treatment traction technique for addressing the upper cervical spine for upper neck pain, cervicogenic headaches from a cervical cause. And I'm your cameraman, so I hope you have a good view of me. I can't see through the lens and film at the same time. I have a skeletal model here that I will demonstrate. A very nice technique for treating traction, and it truly is one of my favorite techniques. And I find very often in my clients that they have a upper cervical restriction. And it's just part of our lifestyle, sitting at desks and working at the computer in which our head pokes forward a little bit, driving cars in which our head pokes forward a little bit, things such as that. And that can be a pattern that is somewhat maintained, and I'm going to show you a very nice way to break up that pattern and hopefully reduce your pain. And now for the disclaimer. I can't diagnose over the internet. I can't know digitally what your unique needs are or what your condition is. Headaches can be a serious medical condition, and you should be under the care of a healthcare provider if you have headaches and upper cervical pain. And I defer to your healthcare provider, and you should only do these techniques with their guidance. And so I'm going to demonstrate on the skeleton the positioning to isolate the upper cervical spine. So here we have the skeletal model on my treatment table, and if we were to do traction on the back of a person, then we would on the back of the head, even if the head is bent forward, we would tend to isolate the lower cervical spine. However, if we gently flex their head but pull on this part of the face and head, more on the temples, in front of the ear and above, if we pull there, then that's going to isolate the force mostly to the upper three vertebrae, and that's what we're wanting to target. And so the technique is a very gentle amount of force. And what you can do is bend your elbow all the way and then pull your hand closer to your shoulder. And that's about the amount of force that we want to apply with both hands on a person's head. So it's extremely gentle. And what we do is we place a small pillow under the head, and that places the neck in flexion. And again, very important that the contact is right here. It's in front of the ear. Of course, he's missing an ear, but in front of the person's ear and on the facial bones and the more of the temple and a little bit of the parietal. So the contact is like that. It's open hand like this, or you can contact with this part of your hand, okay? And the fingers don't do much. So you just come in here like this and just gently tug, so you see a little movement of the body, and then you maintain this force for 2 minutes. And arbitrarily you could do this twice a day for 2 minutes. And if your symptoms are very mild, you can certainly do it a couple times a week. Find whatever works best for you. And we all tend to store some tension in that upper cervical spine. So maybe you can find a partner that you can treat, and then they can treat you as well. It's really nice when you get this treatment from another person, because you get to totally relax. However, if you're traveling or such and you don't have the luxury of being treated by someone else, then you certainly can treat yourself, and I will show you that. So again, you use a pillow to get a little bit of forward bending, a little bit of flexion. And you take your hands and you bring your elbows in against your body, because you won't use as much of your upper body, upper arm muscles if you do it that way. And you contact remember, in front of the ears, part of the facial bone and part of the temporal bone and parietal. And you just push. Just take up the slack gently. Remember, you're only pushing with the amount of force that you would cause your bent elbow to bend a little closer to your shoulder. It's just a little small amount of force. And so you just push here. Less is more. You can have your hips and knees bent, or you can have them straight, whatever's comfortable. And set a timer for 2 minutes. And the reason it's good to use a timer is because when you're doing something passively, 20 seconds feels like a minute. So I strongly advocate the use of a timer. And just maintain that very steady, very gentle force for 2 minutes. Now, I rarely endorse products. I don't own any stock in this company. You can find it on Amazon. And you can also find a video that I posted on YouTube called Upper Cervical Exercises. So just type my last name, H-E, S like Sam, C-H, Upper Cervical Exercises. And this is called a Dr. Reiter's Real Ease, R-I-T-E-R-S. And I think they should have named it a cervical cradle, but they named it Real Ease. So you can find that on Amazon or local healthcare medical provider. And the curved part goes underneath the neck. And I like this because it supports your neck in its natural curve. And it takes out the movement of your mid and lower cervical spine, so you still easily isolate the upper cervical spine when you do that. The trick is that you tuck your chin down a little bit. You want to open up a little bit where the occiput and the first vertebrae connect. And then it's the same drill. You have someone else do this to you, or you bring your elbows in close to your body and open hands on the face and on the head as long as you're in front of the ear, and just take up the slack very gently, very small amount of force until you just get a little bit of engagement. And I assure you, less is more. You're much more able to relax when this force is extremely gentle, and you can apply that for 2 minutes. And again, you should be under the care of a healthcare practitioner, and you can consult them and find out if this is appropriate for you. And there's many causes of headaches, and some are, serious medical conditions, and so you really should be under the care of a healthcare practitioner if you're experiencing headaches. And I hope that this is helpful. I hope that you have a tool that you can use. And thank you for putting up with me being the photographer, the videographer, the filmer, and the patient. Thanks very much. Take care.